Okay, and I'd like to introduce our speakers that we have here today. We have two speakers with us today, Nazareth Ortega and Hannah Lovato. Nazareth is a second year clinical psychology PhD student at LSU. Her research lies broadly in biopsychosocial mechanisms underlying age disparities and dementia risk. Specifically, she's interested in how psychosocial risk and protective factors, as well as cardiovascular health, influence cognitive and brain health in underserved communities. Thank you so much, Nazareth, for being here with us today. And then we also have Hannah Lovato. Hannah is a third year clinical psychology PhD student at LSU as well. Her research focuses on making neuropsychological assessment more accessible through the use of technology. She is also interested in early detection and potential risk factors for neurodegenerative disorders in older adults. So, thank you both so much for being here with us, and I will let y'all take it from here.
Thank you so much and welcome everyone. And thank you for giving us the opportunity to share a little bit about what we do and what we know as regards to this topic of navigating dementia and the next steps. All right. Mhm. Okay, so just as Ellen so wonderfully mentioned, we are a part of the Neuropsychometric Research Group lab at LSU. So we're under the supervision and mentorship of Dr. Matthew Calamia, and he's been a part of Alzheimer's services as well. So you may have seen him around as well. But we're very happy to be here. We take this our research very seriously, and we care deeply about the work that we do in our lab. All right, so I know Ellen also introduced me, but just wanted to give a couple of details, information about myself. So my name is Nazareth Ortega. I am a second year clinical PhD student. I was born and raised in Los Angeles, California, far away from here. But I lived in Austin, Texas, post undergrad. So I personally have seen the impact of cognitive impairment and dementia in my life. My mother was diagnosed with cancer when I was 18, and after rounds of treatment, she developed what is called chemotherapy-induced cognitive impairment. And these are some keywords that Hannah will talk a little bit more about later. And then in my adulthood, both of my grandparents had dementia as well. So this is what kind of has led me to LSU and to study some of the work that we're doing.
There we go. Okay, yeah. So just a brief introduction to me. My name is Hannah. Kind of a little bit of my background is I'm originally from New Mexico, but my father was in the military, so I've moved all across this country many, many times. Additionally, I have worked with individuals with traumatic brain injury. I used to work at a Veterans Affairs health center in Massachusetts, so I got to see kind of firsthand chronic brain injury and how that kind of impacts people's lives. And my research kind of focuses on making things more accessible for people to get access to any of this care, working on the mental health side as we do in our psychology program, and how we can make neuropsych assessment easier and more accessible for people to get. Okay. So the first things we're going to kind of briefly touch on are just kind of we'll give some first disclaimers, but we're going to talk about kind of briefly what dementia is, what does that mean, these kind of big words and diagnoses that you may not fully understand or you're being told and not given all the information. So some first disclaimers, we're doctoral students in training, like Nazareth mentioned, we're under the supervision of a neuropsychologist, but we are not clinical psychologists yet. We're also not medical doctors, attorneys. We'll give you some tips and tricks or other information along some of these lines. But again, we are not fluent in any of these areas, just some general information. And research is constantly changing on any of these topics. So this is as up to date on things as we know it. But of course, new stuff could come out, new technologies, all of that could change in the future. Okay. So, receiving a diagnosis of dementia can be really challenging. There are a lot of moving parts required to navigate this diagnosis for the person diagnosed with the disorder, as well as for their family, friends, their care partners, anyone involved in their care. It can be a big change. So, we're just going to go through some steps that might help you get started, help you think about things that you might need to think about. There's a lot of planning involved in a disorder diagnosis like this. Okay, so getting kind of involved and connected can be like one of the best ways. You're here at these lunch and learns, Alzheimer's Services Center is a great resource. They provide awesome connection with the community. So just some other getting connected with other places, other sources of support or information. We just have some listed out here, which we're happy to share later on. I know Alzheimer's Services has great resources, pamphlets, and all of that to connect further with Alzheimer's centers or things like that. Okay, so kind of going into what dementia is. So how we look at dementia is it's an umbrella term that all of these other disorders you may have heard of kind of falls under. So things like Alzheimer's disease. Alzheimer's disease can contribute to dementia, but dementia is the kind of term that is the functioning consequences of something like Alzheimer's. So this can look like a lot of different things. People can have dementia for a lot of different reasons, medical reasons, any neurodegenerative pathology, and they can have other things that can contribute to dementia. So how is kind of dementia diagnosed? There are kind of two categories of diagnosis as of currently. So mild neurocognitive disorder is kind of the first stage potentially of developing a major neurocognitive disorder, which we would consider dementia. Mild neurocognitive disorder, or MCI, is representing some cognitive difficulties, but those cognitive difficulties aren't interfering too much with your daily life. So the person is still able to function pretty independently at this stage, but their cognition has declined from what it used to be. Dementia, on the other hand, is where the cognitive problems this person is experiences has declined to the position where they are no longer able to be independent at varying levels that we'll discuss, but that their cognitive issues have caused problems in their daily activities. So like I mentioned before, this can be due to all different kinds of pathologies. So Alzheimer's disease is a pathology, something like Parkinson's disease is a pathology, and identifying what those kind of common core symptoms can lead to dementia, where those functional implications come in. So this is kind of like a lot of information, but this just is if you were received a diagnosis of major neurocognitive disorder or MCI, what those kind of words mean and where they might come from. Okay. And how we kind of diagnose this stuff. This is a lot of what me and Nazareth do as clinical neuropsychology trainees. We do standardized neuropsych assessment for both. So MCI assessment, dementia assessment, and that differentiating is the impact of daily functions. So daily activities can include things like kind of complex tasks like managing finances, managing medications, being able to drive. They can also be kind of more everyday tasks, so being able to bathe oneself independently or groom themselves. And where we're looking at somebody diagnosed with dementia would be their cognition decline has impacted their ability to do those things for themselves. So, for instance, an individual with Parkinson's disease may have difficulty using their motor functioning, but if their cognition is not impacting their ability to do these tasks, but it's their motor functioning, that may not be something we would diagnose dementia. It may be still MCI or things like that. Okay. So I'm going to transfer over to Nazareth.
Okay, so that was great to get an understanding of like what this diagnosis is. So what actually comes next? So you receive or your loved ones receive the diagnosis. So what comes next for somebody who's recently diagnosed? And that's kind of what we'll get into. All right. Okay, so starting off with sharing the diagnosis. So, why is it important to tell other people this diagnosis? So, as the disease does progress, the caregiver, the person that was given the diagnosis, is going to need a lot of support especially from a community that they trust or individuals that they trust in order to help them, to help assist them throughout the progression, if that is the case, and just to have an overall support system as it relates to different things that Hannah mentioned, like a lot of changes in daily activities that might occur, and just extra support. So helping the person decide with dementia, just help them decide who to tell. So let's say you do have a loved one that was recently diagnosed, and perhaps they are in the early stages, just recently diagnosed, early stages of dementia, and they're still able to make decisions for themselves and do all these majority of these daily activities. We want to be able to assist them in helping them decide like who do they want to tell, who don't they want to tell. And some of these things are essential to make sure that the person is receiving the care and kindness and attention in their decision making as well. So, for example, assessing the comfort level. So, who do they feel closest to? Who will continue to support them with this diagnosis? So, this is not just within the first month of the diagnosis, but this is something a little bit more long term. And then, who are they responsible for telling? So, this is important. For example, do they have a spouse? Do they have or a partner, friends, family? And one of the things that we want to also add is if they are still working, if they want to tell their employer and how to tell their employer as well. Um, so there's just some examples and ideas to think about, questions to think about when wanting to help support someone. Let's say if it's, your mother, father, grandmother, and being able to kind of help them think about some of these things from the outside perspective. Okay, so after deciding who to share this diagnosis with, consider when to tell the news. So helping this person share the diagnosis with others can be a great relief of the burden. So allowing them the space to let others know on their own terms with your support can go a long way. As we know, this diagnosis can come with a lot of questions, a lot of concerns about the future, a lot of concerns about finances, about how others may respond. So having that support system, navigating some of these things is really important, goes a long way, and just relieves some of that mental burden. So tips from individuals in the early stage is to go slowly. You don't need to talk about everything in one sitting if the person is having some difficulty. You don't have to talk about it all at once and to express the concerns all at once either. This is important to go at the pace in which the person is comfortable with, and just checking in. And it's important that sometimes because it's such big news, we feel like we gotta like get everything going so quickly. But in reality, it's the pace in which the person feels comfortable with because this is their diagnosis and this is something that they are going to be the one experiencing. So I know sometimes caregivers can be very passionate about wanting to help, but just keeping in mind that it's okay to go slowly. And then let the person know that, you know, the people that you are sharing this diagnosis with, that there might be different reactions about this over time. And you can continue to talk about the thoughts and feelings throughout the relationship. So right now, if let's say the diagnosis was given and you're sharing with loved ones, they may feel a little different. The reaction may feel a little different compared to later on, as perhaps if the disease progresses as well. So that's something to keep in mind. And it is okay to do check-ins with that as well. Okay, so the importance in building a care team. So there is help that this care team can do to help minimize the stress and feelings of being overwhelmed. And not just the stress and feelings of like emotions of the diagnosis, but also kind of what comes next, and having people to lean on. So developing your own network of helpers may help be a little bit more productive or active or engaged in life while living in the early stages of the diseases as well. And then throughout the progression as well. So getting people to help with certain tasks works better with a well thought out plan rather than just kind of like if something comes up, it's an emergency and you kind of need somebody there. it's better to have a plan in place to see who's going to be involved in the care team and to what extent is their involvement. So as you can see, we have the middle circle where it's you, close friends and family, so caregivers, and then of course the medical team, and then the community resources, which is what we look at. For example, Alzheimer's services can be that, or it could also be like your church community as well, or any social communities that you partake in, or the person with the diagnosis partakes in as well. Okay, so kind of talked a little bit about this, but who should be included in this? I know once the diagnosis is given, everybody wants to jump on board, but it is important to be realistic and to take consideration of the person who has had this diagnosis. So if you are a caregiver, you'll have to make some decisions for the person with dementia with who to add to the care team. So having conversations with a person with dementia about the type of help they may need currently and then long term, and then building the team from there. So your care team, as mentioned, should include family members, close friends, perhaps neighbors or other people who can help with day-to-day activities. Sometimes we don't really think about neighbors, but they are a great addition to this care team in case, for example, a caregiver is not able to rush over in time. You have some people to lean on, but that might not always be the case for everyone, but something to keep in mind. And then, of course, practitioners, neurologists, counselors, case managers, other specialists. A lot of you who are on this call fit under this as well. And you are also part of this care team to provide some additional support throughout the process. And then, of course, volunteer community organizations, people from the church, other social groups, and other recommendations that they provide as well. Like Alzheimer's Services provides great support systems and support groups that you can test and try. And it's not a one size fits all. It's important to keep that in mind too. So if it doesn't work with a specific group, that's okay. Pivoting and adjusting and maybe trying something else that might work as well. All right. And then, of course, sharing helpful resources to the care team. So, as we mentioned, like coming to these talks, learning more about what dementia is, what does the process look like is important as well to share with the care team. For example, with your family members or caregivers as well. So, the NIA provides great little pamphlets as well to kind of condense some of this information. And then also, as mentioned, Alzheimer's Services provides like different types of pamphlets of different types of topics as well, like financials, but also like questions to ask during a medical appointment or when you talk to your neurologist, your doctor, things like that. And then, of course, case managers are there to provide that extra support. So there are resources in helping the care team as well. Okay. And then as mentioned, support groups. So not just support groups for the person who has been given this dementia diagnosis, but also for the caregivers, for the loved ones. You all need support and just finding confidence in sharing questions or things that may come up with other people who may be experiencing some of these things is a great resource. And of course, there is things like the helpline and then medic alert and safe return. So it's a 24-hour nationwide emergency response service for people who do have Alzheimer's or other dementia related diagnoses as well. And then they have TLC for caregivers, which is tender loving care, which provides caregivers with events where they can and their loved ones can relax. And then there's also opportunities for reimbursement and then arts and Alzheimer's programs as well that the Alzheimer's Services provides. So getting connected is really important, building that care team and providing that social connection, not just for the person with the diagnosis, but also for their loved ones and their caregivers and families as well, in order to help them navigate throughout this process. Okay, so healthcare planning. So scheduling follow-up appointments. So this is something to keep in mind. So we have gotten this diagnosis. We're building the care team. We're learning and understanding what dementia is, what that looks like. And then we're providing connecting to social groups. So now next steps of healthcare planning. So scheduling follow-up appointments. So primary care providers to schedule appointments with primary care providers to review the diagnosis. Either if you have additional questions, or this could be after you also have connected with your care team and maybe they need to also be in the room for that. To kind of understand where the person living with dementia may be in the course of the disease, if this wasn't already a conversation that was had. So if they're in the early stages or middle stages and where they lie within that disease progression. And then also monitoring new or ongoing health concerns and how they interact with the dementia diagnosis. So this could be something like individuals who have hypertension or they're managing their cholesterol or have other underlying conditions as well, like congestive heart failure or different things, how that may interact with the dementia progression and just the diagnosis overall, making sure that you are asking follow-up questions about medications, anything that you do need to take, or being able to take care of that portion of that as well. And then, of course, following up with appointments that are specific to experts of this disease. For example, follow-ups with neuropsychologists specifically. As we mentioned, we are students in training for this. So this is the assessment is helpful to kind of help monitor current symptoms and then provide updated recommendations for that as well. Of course, your neurologist is important. A neurologist is important to set up appointments with as it relates to medication management, specifically for this dementia diagnosis and rehabilitation. So any speech, language pathologists that need to be seen, any physical therapy as well, as there's like different changes happening, not just in the beginning, but also throughout the progression of dementia. So it's important to revisit these plans as the disease progresses, and doing those check-ins within your care team to also help support throughout these areas as well. Okay. And as mentioned earlier, ensuring to stabilize certain specific chronic conditions. We talked about hypertension, diabetes, reviewing medications, and their interactions for cognitive side effects. Medication planning, monitoring, keeping pill boxes, caregiver logs. If there's multiple people in that center circle of the care team that are assisting and supporting the person with the diagnosis, then it is helpful that there is um, there is logs so that everybody kind of knows what's happening. And then supportive materials, checklists, medication trackers, visit prep sheets with support system. So having like a binder, and we'll talk a little bit about that, so that everybody is kind of cluing into like what's happening, who did they see last week, what are the updates from the visit, things like that. And also so that you're not having to consistently ask the person with the dementia diagnosis, um, and can relieve some of that burden, the mental load as well. And then getting extra help when needed. It is okay to get connected to home health aide, any nurse visits or case managers as well. And there's a lot of resources for that. And even if it's just to get a consultation to see like, what is this about? How is this helpful? What are the pros and cons to this? And there's a lot of programs and resources for that as well. Okay, and as mentioned, there's different ways. This is some of the ways that it looks like. For example, keeping up with healthcare appointments. This is like a, excuse me, like a little checklist of what that looks like. For example, their last eye test, last hearing test, the last dental checkup. When was their appointment? Was there any, excuse me, any highlights of that appointment that need to be shared with the rest of the care team? Pill boxes, if that's not something that's being used, is very helpful as well. And then also For example, if people have certain allergies, there are certain like bracelets that you can keep, and then there's different types of medical cards that you can put either in phones or attached to wallets to help keep everything condensed. For example, if your loved one with dementia is out and about, that is something that they can keep and hold on to as the disease progresses. That might it might be a little bit difficult to remember everything, but that's always super helpful and a good resource for that for them to have as well. Okay, so going into advanced care planning. So advanced care planning, we're looking at the disease progression as well. So advanced directives are specific to legal documents that are outlined by the person with dementia's preferences, and they apply only if they are unable to make decisions. So for healthcare planning, advanced directives communicate a person's wishes ahead of time. So doctors and other providers follow these directives for medical treatment. So as mentioned, we want to be respectful to the wishes of the person that has been diagnosed with dementia, and looking at the disease progression if it is later stages of of the disease. We want to make sure that we're still honoring and respecting that, and this is one way to do that. So assigning a healthcare proxy um, is a good approach to that as well. So it's a durable power of attorney for healthcare that names somebody as a proxy to make these medical decisions. So, for example, you're appointing a spouse or you're appointing a loved one, a caregiver for to be able to make those decisions if they are no longer able to make decisions for themselves. And normally that is something that you can talk to medical professionals about. And then also there are other ways to make it more to have like legal documents in place so that there aren't any questions or confusions later on as well. So that's something to keep in mind. Okay, so if an advance directives are not in place and a patient can no longer speak for themselves, someone else will need to make those medical decisions on their behalf. So advanced planning for who this person would be is important, and having these conversations early on when you're able to communicate with the person making with the diagnosis of dementia. So, for example, in the later stages of Alzheimer's disease, people may have trouble swallowing, which can bring food or liquid into the lungs and cause pneumonia. So, the doctors may recommend a feeding tube connected to the nose to the stomach for nutrition, or a ventilator to help with breathing, or any antibiotics to help fight the lung infection to help with recovery. However, some people may want to focus on comfort rather than recovery if the illness does occur near the ends of life within that progression of the disease. This is one example of something to keep in mind. Again, this is towards the later stages of the disease, but this is something that could occur, and we want to make sure we're honoring what the person may want to focus on, either comfort, recovery. So that's something to keep in mind. And of course, as a disclaimer, this progression looks different for everyone. So that's also something to keep in mind. Okay, so these conversations are difficult, and planning early does allow the person with dementia to have some agency in these decisions of care with the caregiver's assistance. Medical decisions to consider when planning ahead are what is called a DNI, so it's do not intubate, which lets medical staff in the hospital or nursing facilities know that they do not want to be put on a breathing machine. And this is kind of going back to comfort over recovery and treatment and things like that. A DNR, for those that are not familiar with this, do not resuscitate, which tells healthcare professionals not to perform CPR or other life support procedures in case of if the heart or breathing stops as well. There are other types of medical orders, specifically like the POLST, physician orders of life-sustaining treatment, and then the medical orders of life-sustaining treatment. So these are just other documents, formal documents that you can put in place in order to be able to respect the decisions of what the person with dementia wants as their disease advances and progresses as well. Okay, passing it over to Hannah now.
There we go. Sorry. Okay. So I'm going to talk just a little bit more about some other kind of legal stuff because there are a lot of kind of legal, financial changes that will need to happen for an individual diagnosed with dementia. So like Nazareth mentioned, there are varying stages, even with somebody with dementia, where they may be at in their decision-making capability. So there are a couple avenues you can go for that. We'll talk through some of them. So a power of attorney is a legal measure that you can take as a caregiver to have legal authority over all decisions. This includes healthcare and financial decisions. There are different designations you can have for this. Typically, temporary things would be used for things outside of dementia where a case could potentially reverse. That is not usually seen in dementia, but this is something where the individual with dementia, if they still have the ability to make these decisions for themselves, can work with you to get that set up, or you can assist them in that process. Again, giving them agency in their decisions. It's also something that you can apply for if the person is no longer able to make decisions for themselves. Another thing is a living will, which allows kind of, again, that decision making of what would you like done with you if something were to happen that you can't make your own decisions. So that can go along with a lot of the other things that Nazareth mentioned about kind of those orders of what do you want your care to look like? What do you want from that? These are also all things that need to be, the person with dementia needs to remain capacitated to make these decisions for themselves. Somebody in the earlier stage of dementia may still be capacitated at certain times to make these decisions for themselves. So early planning is helpful to give them that agency, and also knowing that these things are there if that decision making goes away, to go forward with these decisions to allow yourself the power to make these decisions for them. Okay. So a lot of other kind of legal changes, financial changes, power of attorney, you would have to file that, and you would be responsible for all financial and health responsibilities for the person with dementia. So what does that look like? What does this person want for themselves? How do we set up their finances in a way that they will be well managed? How do you manage their care, their money, things like that? So if somebody is still in those kind of early stages where they can still potentially manage their finances, but maybe need a little bit of help, maybe the caregiver can set up some things for them. Automatic bill payments, so the person is not missing any bills. Giving them a limited chip and signature card that has less capabilities than a regular credit card would have. To limit kind of impulsive spending or forgetting that they already bought something, kind of limiting their ability in that way to assist them with financial decisions. And then again, that kind of power attorney to make those more complex financial decisions for later on. Um, at some point, financial decision making will need to be transferred to somebody else. So again, planning early, getting these things kind of done sooner rather than later we're all about, providing the person agency in their own decision making. It can feel overwhelming also to have all of these decisions put on the caregiver when you're suddenly have a family member, maybe a parent, who has this diagnosis, and suddenly you have to manage all of their decisions for them. And maybe you're not sure what they would have wanted. Um, Planning as early as you can help you maybe compartmentalize some of those things across time, even if um, that person is still not able to make those decisions for themselves. It can help relieve some of that burden on you of having to decide everything all at once, picking out kind of the first thing to tackle. How do we manage the mortgage payment? And then going from there, what's the advanced care? What kind of health considerations? Things like that can make it a little bit easier to take over all of these responsibilities. So again, that's kind of can look like different things. So determining long-term care. What might this person want for long-term care? Does that look like living in a care facility? Will they require being in like a memory care facility? Is independent living an option for them right now? Is that living with a family member? What does that look like? And how the logistical side of it, how do you pay for that? How is this person going to pay for that? How is this going to be supported in those different ways? So all this stuff, like I said, is really big decisions you have to make for this person, big things you have to plan out that may not be happening right now. They may not need to move into a care facility right now, but talking about it now or planning for when the decline is more steep, they should move into a care facility. Looking at ones early can alleviate some of that burden of having to do it all at once. Same with healthcare decisions. Um, like a care aide or a nurse having, is somebody going to come in and see them? How often might they need care? Do they have chronic medical conditions that they need care for outside of that? And again, that all wraps into kind of the financial decision making and how that all plays out. So a lot of this financial legal stuff is just some kind of little snippets of things that you might have to think of and really just kind of starting early and planning as much as you can. Of course, it's not a perfect world. We can't plan for everything and we can't know what's going to happen every time. But if you have these conversations now, you might be able to, I know what my mother would want. I know she would not want to live in this facility, but she might want to live in this facility or things like that, to give the person with dementia some agency as well as yourself to not suddenly be bombarded with a million decisions that feel like they all came on within a day. Some other things that kind of might change with an individual with dementia is communication. So this can look like a variety of different things based on where the person is in their stage and based on the disorder they have. Individuals with frontotemporal dementia, by the nature of the disorder course, may just have more difficulties with language. Individuals with Parkinson's may also have more difficulty with language due to motor changes in their ability to speak. So this could all be for different reasons, but communication with the person may change for those reasons, as well as their ability to understand, comprehend, and express themselves. So this can affect a lot of things. This can affect how you're able to communicate to the person their care, as well as they're able to communicate their needs to you, what they would like, and also can be isolating for the individual with dementia. When they're not able to communicate their needs, they may feel kind of separated from their social networks, from their family, their friends, which are all risk factors for further decline faster. So we try to maintain social integration and communication as best as we can, because those are really great protective factors for being engaged and kind of maintaining or like slowing that decline. So I'm going to go through just some like common do's and don'ts of kind of communication. Um, Communicating with a person with dementia can be frustrating for both. So the person who has dementia may feel really frustrated that they can't communicate themselves or that the other person isn't understanding them. It's a giant change from potentially how they used to speak or understand language. And it can also be frustrating for the person interacting with them. And this can be, healthcare providers, family, friends, any spectrum where the person would have to communicate. These are just some like do's and don'ts you can try to remember and check in with yourself if you feel like you're getting frustrated. If you feel like the person with dementia is getting frustrated, you can, take breaks, come back to it later, to kind of maintain as much of that conversation as you can while recognizing that it has changed. So kind of just using simple sentences, repeating yourself when needed can be really helpful. Again, this will be kind of appropriate to the level that the person is at. So if a person is having no difficulties with their communication, this may look different. You may not have to use these things, kind of want to meet them where they're at and using kind of making sure you're talking directly to the person, using engaged body language. Often people with dementia find that um, maybe their doctor is talking to the caregiver instead of to them. So like not pretending like they're not in the room and just kind of speaking too quickly, talking to the other person, talking over them, finishing their sentences, things like that. So just trying to check in with yourself, see if you notice some of those things coming up and just trying to engage more with the person. You can also use a lot of technology as a great tool for communication as well as for other things. So there are different apps that you can use that can allow for different kinds of communication. You can use technology for all kinds of reminders, clocks, timers, for medications, things like that. All of these things can be used to help the person kind of develop some compensatory strategies for things like forgetting medications, things like that, as well as communicating to family members. You can use phones or apps that are kind of more simplified in design. So they only have like a few buttons on them. They're larger for the individual to see better. So they can call family members. There's only those numbers on it. Things like that make it a little bit easier to stay connected and just to communicate a little bit easier between the person with dementia and like their family, their friends, their caregivers, things like that. Additionally, you can use like visual communication boards. This might be more where the individual is really struggling with language. So kind of common cue cards. This, still kind of engages them as much as they're able to kind of provide what they can at the level that they're at. But these can be used for like common phrases, things like that, pointing to the things they want, the things they don't want, stuff like that. Okay. And then another thing kind of to keep in mind is kind of the safety of an individual with dementia and how the kind of things that you might need to change in their physical space or how to like maintain their safety. So an individual with dementia, again, this could look different for a variety of reasons. Individuals, like I mentioned, with Parkinson's disease may have more motor problems. They may require mobility aids like a walker. So maybe this requires a move from the second floor to the first floor, getting a chairlift, kind of simplifying the layout of rooms. This is something where your neuropsych assessment would be helpful in recommendations as well. Kind of what things is this person struggling with and how can we accommodate their space, things like that. So any kind of safety devices would be helpful, kind of alarms, things like that. All of this can get wrapped in kind of that care planning and kind of what does their day-to-day living look like, who's involved in that, and what kind of things do we need to make sure we are checking off if they are remaining somewhat independent. Yeah. Okay. And then the last thing I'm going to touch on before we answer some questions is kind of there are a lot of different things that can affect the rate of decline. An individual with dementia is not likely to be able to reverse that decline as of our knowledge currently. There are many things that can contribute to the decline getting worse faster, being steady. But there are some things that can kind of slow down that decline a bit. These things can also be helpful to slow down decline in those early stages of mild cognitive impairment, where the cognitive changes haven't really impacted their daily functioning. So I'm just going to go through some of these things. These are also things that are just kind of helpful to do, even if we don't see any changes in the decline. They just are helpful to keep people engaged, for example, do things that they like, stuff like that. So there's kind of these pillars of healthy brain aging. And these pillars apply, like I mentioned, kind of slowing that rate of decline for MCI, potentially slowing the rate of decline for dementia, as well as for people who do not have any cognitive disorders. These are just things we recommend for everybody, and their applications for individuals with MCI or dementia. So physical activity is a big one. This will, of course, change depending on how able the person is to move around. So this can look like using chair fitness classes instead of going to the gym, watching online stretching or yoga classes, something like that. This also, healthy eating is really important. The Mediterranean diet is recommended, just eating a lot of like fresh vegetables, fruits, fish, beans, things like that is just recommended and can help improve not only your cognitive functioning or kind of like we mentioned, slowing that rate of decline, but can also help with any health conditions. It's great for high cholesterol, blood pressure, things like that. So a lot of these things can hit a lot of those things at the same time, which can all reduce a little bit of that burden of the decline. Another thing, like I mentioned, is social connection. This is really important. Being connected with your family, your friends, your social group, anyone kind of around you. So, like I mentioned, some of those language shifts may make this a little bit more difficult, but making sure that the person is still kind of engaging socially, that they feel connected to their people, can be helpful. So, like setting up some time that the person gets to talk with maybe their grandchildren, or that everyone comes over for dinner one night. Something like that can help just maintain that social structure, even if it has to change a little bit. Another thing is engaging your brain. So doing kind of novel, engaging activities is really helpful. So things that you really like to do, learning a new skill, things that are fun. This can also go along with social engagement. Maybe you do a new hobby with friends. Maybe if you and your mother learn a new skill, like sewing, taking a pottery class, playing a game like chess or bridge, things all like that kind of engage your brain and help some of that cognitive decline, a little bit less steep as it goes on. And then the last couple things, mental health is just as important as your physical and cognitive health. So a lot of the things I mentioned before can help bolster your mental health. So just checking in, some of the most common disorders with individuals with neurodegenerative disorders are anxiety and depression. So kind of just checking in on your mood, checking in with your doctor if you think these changes are more significant, what can we do to help that? Would therapy be recommended? Medications for advanced depression, things like that, kind of checking where you're at. This is very common for this illness. So just keeping that in mind that that can be just as important as the physical stuff to their well-being. And then the last thing is healthy sleep. So maintaining healthy sleep is a great thing. So what this can look like is developing a routine for your sleep, going to sleep at the same time every night, putting away screens or books or things that could keep you up, minimizing noise, stuff like that can all be really helpful. Again, all of these things can look different depending on where the person is in their trajectory of the disease. But just trying to maintain these things as best as you can will be really helpful. Okay, and that is all we have. So any questions? Thank you everybody for listening.
Thank y'all so much. That was a fantastic presentation. So much good information y'all shared. I wanted to start off with a question. Hannah, in the section about home safety, you mentioned that a neuropsych assessment can help, with things like home safety. So I was just wondering if y'all could talk a little bit about neuropsychological assessments, what they look like, what's included in that, and what types of things can they help somebody with.
Yeah. So a neuropsych assessment, I'll kind of start from the top to the bottom. So I'll run you through kind of what an appointment would look like. So a neuropsych assessment would be used if a person is concerned about their cognitive functioning and they're kind of wanting to see, is this something where it might be in the MCI range? Could this be normal aging? That is also something a neuropsych assessment could tell you. Or is this more indicative of dementia? So what a neuropsych assessment looks like is your clinician goes through an interview with you, asks you a lot of background questions about your concerns about your cognition. How are you performing your daily activities? Have those things changed? A lot of medical questions. Have you had a stroke? Chronic medical conditions that could impact any of these disorders. Additional medical records, if available, things like that. We get a lot of detailed background onto how these are different than you used to be. What has changed? Is this how you've always been? Is this a big difference? The second part of a neuropsych assessment is the comprehensive testing. So this is not testing like school. There's no really like right or wrong answers type of testing. It's different testing of your thinking and your memory. So tests on your attention. Are you able to remember things later on? Are you having trouble seeing the world around you outside of your vision? Things like that. And those can help tailor a lot of that kind of pathology stuff. So if there are declines in your cognition, the neuropsych assessment can be helpful to determine if it falls under one of those pathologies we mentioned. So like Parkinson's disease, those that test results, things like that would look a little bit different than somebody who has Alzheimer's disease. And based on those, we provide recommendations for either. And that can look like different things. So referring to like a neurologist for medications for somebody with Parkinson's disease. If somebody is having a lot of mobility issues, maybe a referral to speech or physical therapy or speech pathologist, things like that. Recommendations for mental health care, all of those kind of what on your testing, what am I seeing there? I'm seeing a lot of problems with attention. Okay, maybe we want some more like writing things down, keeping a lot of lists, stuff like that. We can provide that based on how your cognition is presenting to us.
Thank you so much. And Nazareth, did you want to add anything?
No, I think Hannah touched beautifully. I was looking at the chat and one of the questions was related to what Hannah had mentioned, so I just wanted to make a note of that.
Yeah.
Um,
So we did get a similar question, a related question. Are neuropsychology appointments covered by health insurance, similarly to maybe a neurologist appointment?
So that depends on the place.
mhm.
So, for example, I work at Our Lady of the Lake Hospital providing neuropsych assessments because I'm a graduate student. Those are not covered under insurance, but other places, depending on the hospital or clinic, are typically covered under insurance, depending on your policy. It'd be more kind of that stuff. It's not something that always falls under no. Um, Typically, I would say they are covered just depending on the institution, and usually they'll tell you if that's something right off the bat they don't accept insurance for.
Thank you. And what is the average length of time for an assessment like that?
It kind of depends on what the reasoning is for. Typically, an assessment can vary from like 4 to 5 hours. If the person is having a lot of difficulty, say with their speech, just may make the interview or the testing take a little bit longer, may go up to like 5 or 6 hours. That's around the ranges I've seen, and that can be split up across days, things like that. Typically, at least try to get it in one day if you can, or split it to like 1 to 2 appointments.
Thank you so much. We have a couple other questions that have come in. Um, is there a test that you guys are familiar with to assess dementia maybe before it occurs? Are you guys familiar with anything like that?
Yeah, so I believe I was trying to type it in the chat. Sorry about that. But yeah, so as mentioned, Hannah was talking about the neuropsych assessment evaluation. So this is something that you can talk to your primary care doctor. There are also screeners that you can also request. And we just ask to take extra precaution when asking about the screeners. The screener is not an evaluation, so you can ask your doctor about the specific type of memory screeners that we do. There's different kinds that you're able to request and have done, but it is just that it is a screener. And if there is any additional concerns, then it is important to get an evaluation done. It is a lot more extensive. Hannah, if you wanted to add to that.
No, yeah, that's good. Like neuropsych assessment, like I mentioned, can also identify that kind of either early stages or if it's just normal aging and then maybe monitoring for the future.
Thank you both. And just to add to you guys' point too, there is a new, just like on the medical side too, it's something else you can ask your primary care physician about. There is a new blood test that has been approved recently that can help to detect early dementia. So something worth looking into for sure. Early Alzheimer's disease. We did get a question about anosognosia. Are either of you familiar with anosognosia or have anything you could talk about that a little bit?
Yeah, that's funny. It's actually one of my research interests. Anosognosia, for those who are not familiar, is the lack of insight into one's cognitive decline. This can make it really hard to tell how somebody is doing. How typically you might, if somebody, has been diagnosed with dementia and they are having difficulties with the insight into their ability, it can make it difficult when you're trying to plan with them or for them and they're not understanding like, oh, I'm fine, I'm not having any problems. Um, this can be where using like an outside resource can be really helpful, using kind of like a third party to kind of mediate those conversations, having the care partner in the room when they're receiving the neuropsych assessment feedback, things like that. Working with primary care, like as kind of that mediator, like, hey, we're seeing these problems. This person wants to help. I know you're not really seeing these problems, but we want to make sure that things are going well. This can also be something that like mental health services or other things for that person could be helpful in terms of if like often like anger, frustration, things like that may come up more often for people with lack of insight. So kind of tackling those separately may be helpful too.
Thank you so much. That's very helpful. Good advice for that. Um, Now we did get another question about like physician referrals. So is this something to get a neuropsych assessment? Is it something that you need a physician referral for, or can somebody just call and request something like that? How does that usually work?
I believe depending on the organization, you can do either.
Hmm.
Um, it may be easier to get a doctor referral just because it may get through the system faster. The downside with neuropsych assessment is wait lists are typically very long for whatever facility. They're not many neuropsychologists, especially in more rural areas. So going through your primary care or getting a referral may be easier just to kind of get it to the top of the list or get it sent over easily versus I believe you can still contact the neuropsychologist directly. It just like maybe a little bit more difficult to get directly to them than through a doctor.
And also keeping in mind the cost of it. Normally, a referral will help um, speaking with your doctor and if they have any referrals for specific like individual doctors who have who take certain insurance versus those who have like certain like income waivers or plans and things like that. That's also helpful to keep in mind.
Thank you both. And Nazareth, I see you shared some books in the chat. Can you just tell us a little about that too?
Yeah, so I am all about, you know, education, knowledge, informing yourself, staying prepared so you don't have to get prepared. But it is helpful for caregivers and loved ones to help understand a little bit more about what's going on in with our minds, our memory, our thinking skills, and how does that look like as it relates to individuals who may have cognitive impairment or dementia as well. So these three books are ones that we recommend and ones that we talk about a lot in our educational talks. So keeping your wits about you is by Dr. Dotson. So she is also a neuropsychologist. She does a lot of work as it relates to physical activity and sleep and the relationship between heart health and brain health. So she incorporates a lot of that information in a way that is digestible to understand, because we know that there could be like missing kind of just communication issues when understanding some of these like big words and big terminology. And it can be frustrating as someone who was not exposed to this until I came to, education and research. It is helpful to be able to understand a little bit better, digest it. And then she talks a lot about the six pillars that we talked about. So the physical activity, mental stimulation, um, nutrition, social connection, how all of these actually help for individuals have healthy brain aging. And this is separate from somebody who does have dementia. But as Hannah mentioned, it could help reduce some of the steepness of the decline as well. So great resources there. A lot of recommendations. There's some like little tips and tricks that she puts in there, but a lot more digestible. And then we have similar to other things, we have the healthy the brain health book, excuse me, and then the high octane brain. So this is also just some more information on the different types of changes that happen with memory. And then these are all by doctors. And that's something that we also want to emphasize that there's a lot of information being put out there. And not a lot of that information is evidence-based or specifically done by that has been validated and is reliable. So we want to also um, keep that in mind when looking for resources and support that we are talking with trusted sources. Like Alzheimer's Services Center is a great resource to check in, and then also our research lab as well. So that's just something to keep in mind. because we love information and we want to know what to do and what are the next steps and who do we talk to. It can get a little overwhelming, but it is important that one, we take a breath, and then also just make sure that we are accessing reliable information and not any type of false advertising or things like that, because we want to make sure that we do the best thing that we can to help live quality lives as it relates to brain health.
Thank you so much. And for everyone that's on the call, I will put those books that Nazareth shared, I'll put that in the follow-up email too, in case you're interested in looking them up. But again, thank you both so much for sharing this information today. Hannah, there is a thank you in the chat for you about responding to the question about anosognosia and your great advice on that. And just thank you both so much for taking the time out to share all of this great and helpful information. And thanks to everyone who joined us today. And I hope everyone has a good rest of their day. Thanks so much.